what we're going to do is we're going to start on our wonderful new Blue Cross website. It's so pretty. We're going to make sure that we log in. And I don't know if this is everybody's first time that they're seeing this or not, but it might be. I think it was changed over the weekend. It's so pretty. All right, well, there. Let's see. Hopefully this works. Otherwise, this is going to be a really short meeting today. Okay. So once we log in, we're just going to deal with our basics. We're going to go to our individual sales process. We're going to have our 3 boxes. And really what we want to start with is the insurance marketplace. Now, we do have our subsidy determination tool that's listed here. I really don't recommend using that tool as your tell-all. I actually don't recommend you using that tool at all. I've sent out to everyone the Value Penguin, which is a good way for you to, if I could spell today, to use the Value Penguin in order to identify some subsidies. Now, you do have to be aware that if you're using the Value Penguin, that is only going to be good for when everyone is taking the insurance. Okay, so if you've got one of the complicated cases where husband's on Medicare, wife's not, you have one child that's from a divorced family that they claim them this year, they claim them next year, and it goes back and forth, just kind of put all of those on the back burner. Okay, because those, until we have clarification from the systems that they're working, they're not going to work. So just be aware of that. But the Value Penguin is a good tool, probably the best of all the tools that are out there to identify subsidy amount. You would just simply select your county that we're looking at. You would select the household size, for example, and just be mindful that it's got to be something simple. That if we start getting into something more complicated, and when we put our income in here, if we did, leave it at 35,000, we click calculate, and then it ends up showing basically what our income levels, what our subsidy levels are going to be, out-of-pocket maximums. And for this particular county, as you can see, we are the only provider. Okay, so you just need to understand that there are some issues. Use this. When you are going through and when you're trying to address and figure out what those subsidies are. Now, the reason why this is so important is because, let's face it, the Affordable Care Act is not affordable unless you get a big fat subsidy. So you have to remember that when you're talking to your clients. You have to go into your conversation knowing that if they can qualify for a plan and they're not highly subsidized, then don't bother. Give them a regular underwritten plan. You could give them a hospital surgical plan. Give them anything, okay? Because it is going to be in their best interest if they're not highly subsidized to take one of our standard plans. Now, obviously, you're having to identify whether they are going to be healthier enough to get this plan. That's always going to be the $64,000 question. And as many of us have known throughout working with Blue Cross for quite some time, that these issues that we have with underwriting are still going to be there. You're going to be able to sell all of these underwritten plans until the end of the year, till the 23rd of December. Okay? Now, they're talking about being able to allow you to write these plans until the last day of December as well. They would backdate those policies for an effective date within the range of compliance for qualified health plans, so we'll have a 2013 effective date. And all of these people who take an underwritten plan would be able to keep that policy. Now, that policy will be able to be kept tentatively as of today, which, as we know, most everything is changing on a regular basis until the 31st of 2014. And will that change? Who knows? I have no idea. But all we know is what we can deal with currently, and what we're currently dealing with is write an underwritten plan unless there's insurability issues. Because if it's the matter of that person affording it, they have to be highly subsidized, because if they're not highly subsidized, they're still going to be in the same boat. In addition to that, you also have to identify the family glitch. Don't get all the way through your application for your subsidy to find out that, oh, well, the husband doesn't have he has job or he has a group insurance plan, but I just don't want it. Well, that's not a valid reason, and they would not be subsidy eligible. So let me kind of address what could happen and how that's going to work if you decide that you think it's in your best interest to tell the client, oh, don't worry about that. Well, what's going to happen in that situation is that person is going to get a penalty. Okay, and then you would be the one that directed them in that capacity and would be effectively causing them to have that penalty. It's not a good idea. Just because other agents and other agencies don't understand the rules, there is no reason for you to make sure that you. Okay, thank you, Eddie. There's no reason that you should be really just showing them this basic idea to, oh, don't worry about it. We have to do our due diligence when it comes to the end of the year and they're filing their taxes. They're no longer going to be dealing with you or Blue Cross. They'll be dealing with the IRS. And that would be effectively because something that you advise them to do. So understand that. Also understand that your families that are filing separately must file a joint application when it comes to 2014 taxes. And if they fail to do that, they will not get their subsidy. So these are basic rules that we've been covering over and over and over again, all of which are represented in the training that we've done on the YouTube videos that you need to go through and reference. And if you haven't referenced them, then now is the time to do so. Okay, and make sure that you understand it and make sure that you're going through it. So what's going to happen first and foremost, you're going to come into Blue Cross, you're going to log in, take a little sip of my Red Bull. Thank you very much, Eddie. All right, so now you're at the health marketplace. You click on the direct link, and it's going to open up a pop-up window. You have to make sure that that pop-up window is up and open. And with that pop-up window, remember, you only want to be using Firefox or Chrome. If you're using Internet Explorer or you're using some other browser that you found, it's not going to work. You're going to want to use Internet Explorer or Firefox, and that's it. You want to keep this pop-up window open, and then you're going to want to put your password in. Now, the password that you're going to be using is the password that is represented on the CMS portal. Okay? Now, many of you have had errors where you're putting in that password here, and it's blanking out the username and password. So, for example, if I put my password in here, and I click Login, and it brings me back to this cleared out screen where my username and password are now gone. You did one of two things. You either have the wrong password in there, or the password that you are using is incorrect and needs to be updated. Now, how do you update that password? How do you make sure that this is correct so you move forward? Well, you're going to go to step 2 in the CMS portal, which is the screen that you see right in front of you here. And what you're going to want to do is you're going to want to log in to the CMS portal. Now, when you log into the CMS portal, the username and password combination here is the username and password combination that you must be using here. So come in here, log in, and make sure that you can get into this website. If you can't get into this website, this is where your issue is starting, and this needs to be fixed and identified before you can go any further. So if you haven't already gone through and done this, then you are going to need to do this. Click on Request Access. The second troubleshooting thing that you're going to want to do is you're going to want to make sure that you have access listed here as the federally facilitated marketplace. If you don't, then you're going to want to go back to the original training and you're going to want to make sure that you have this added as a role. Now, because of all of the things that have happened on the back side and with CMS and with HHS and all of the errors that they're having from a computer standpoint, some people have lost this certification. Some people never even completed it to begin with. So go in here and make sure that you can access those areas. Once you know that you can access that, Also, what could happen when you're in here is that it will ask you to reset that password, and the password needs to be reset every 60 days. So if you've been going along perfectly and you've been able to log into this site every single time that you've been working, and now all of a sudden you wake up on Thursday morning and you can't, then you're going to end up in this site here. You're going to have to update your password. When you log in, it'll prompt you to fix a new password, and then when you fix that new password, you will immediately have access back here under healthcare.gov from our direct link. Okay. So now, what happens if that username is incorrect? So in other words, when I click on my Go to Marketplace, then my username is not right. Well, in that capacity, then you will have to go back into Gorman, which is located on our main page, and make sure that you have adjusted that username, and that is clearly identified in the training video, and we're not going to go through it today. So if you're having that issue, watch that video, get those things completed, so that way you are comfortable and you are clear. Now, for today's representation of what we're going to do, I'm not going to go through a complete application on the marketplace. There's a video for that, but what we really want to do is talk about some of the additional troubleshooting areas that we're having, and then we also want to make sure that you're understanding some of the basics with the plan. So now, before I go into that, a couple of questions come in. All right. And let's kind of address some of those questions. Some of these questions I'm going to address later, so I may not address your question currently, but I'll get back to it. All right. Well, here's a good one. If an applicant already registered for the marketplace but didn't select an agent that helped them, when we go back to change or add the agent number, can we do that during the Consumer Connect? Well, there's two ways for that to happen. Realistically, the best way to do it is to do a whole new application for that client. The process is pretty smooth at this point in time and this point in the game. So I would do a whole new application. Your second option, believe it or not, is to call healthcare.gov and have you added, and give them your national producer number and have you added to their application. So those are really there's two ways to do it. My suggestion would be to go through a whole new application, clicking on the marketplace, going through that application. Now that application will bring you back into the Blue Cross at the end of the process. And then what we're going to do is we're going to kind of talk a little bit now about what that looks like in Florida Blue. Okay, but to save everybody time, energy, and headaches, we're going to do it a little differently. So let's just figure that I'm doing a tester application. You are going to want to make sure that you're putting in an email address. Now, when you are on the healthcare.gov website, when you're doing that application for the client, let's first adjust some of the many issues that we are dealing with and that you are dealing with on a day in and day out basis before it brings you back into healthcare.gov. Back into Blue Cross. So the first thing is that the Social Security number. So originally, which was all about a whopping 2.5 weeks ago, when the video for how to process the application, which is right here, was completed, it was not working when you used the Social Security number. Well, they have done an update, so a Social Security number is going to be necessary. So you are going to need to make sure that you're doing that. An email address is going to be necessary as well. Now, when you're going through that application process, you have to be very conscious about the incomes and the type of incomes and who's taking the insurance. And there are small little idiosyncrasies that you will deal with on a day in and day out basis. You know, the majority of the ones that we're dealing with now that are causing everyone headaches is really going to be the husband on Medicare, the wife not on Medicare, and why is it not spitting out a subsidy? Well, the problems that we're experiencing with that are typically because the main taxpayer is the one that's on Medicare, so you have to be conscious of that. Typically, if the wife was the main taxpayer or the husband was the main taxpayer and then the other party is on Medicare, we've actually got those to go through in a lot more consistent basis. But when we're talking about the types of income, those levels of income, a lot of the confusion has been the difference on Social Security, supplemental Social Security income, which is disability income, and then regular Social Security income. So if your client is over the age of 65, they're getting Social Security, then that is taxable income. Now, the problem that most people are experiencing is that taxable income that they're looking at, well, they don't pay taxes on it, so they think that they don't have to list it. But they do have to list it. So if there's a husband and a wife and one person is taking those distributions, then you do have to list it. What doesn't count is disability income. So if the husband, for example, was on disability at age 50 and he's getting disability income, but the wife is not working, they don't get a subsidy because they don't have enough income. Now, if they have other investments, if they have other types of income that they want to list, well, then by all means, you can utilize that other income. But the SSI income, disability income, is not eligible and doesn't count towards this. So you have to be conscious of that when you're doing it because it is going to make a big difference. So that is probably one of the biggest issues that everybody's dealing with is somebody's getting Social Security, somebody's getting disability, and we're having an issue. Additionally, that what we're also having issues with is we're having issues with the children, as I've stated over and over again. Adult children is also another issue. Now, if your adult child is filing their own taxes, but you, as the parent, are claiming them on your taxes, then that child needs to be on your policy. You can place the child on their own policy if they're filing their own taxes, but mom or dad cannot also claim that child as a dependent, because being claimed as a dependent will then force that child to be on the family's health insurance policy. One of the big things you guys have to really kind of understand is that the way that the taxes are filed is driving how the insurance policy has to be structured. Because what you are going to see is what you're going to see a lot of people that are going to be trying to get out of this. And in many cases, it's a good thing for them to try and get out of it and get that child their own income, to get their child filing their own taxes, because if the subsidy is so substantial that it outweighs the write-off that they get for that child, it may make good sense. Now, this is where you have to bust out your handy-dandy calculator. This is when you need to be referencing our charts that we've been using since, the beginning of all of this to identify what those subsidy levels are going to be, identify what those costs are going to be. And let me give you a personal example. A client who makes a ton of money, has group insurance, they have an adult child, and that adult child is not on their current insurance policy. Now, that adult child is a full-time student. So what would the solution be for that child? Well, that child would technically have to be on the parent's insurance policy because that's a group insurance policy. That's our family glitch. All right, they wouldn't qualify for a subsidy unless the adult child is going to file their own taxes and that adult child is going to make over the threshold of the $11,000 plus amount, that 100% of the federal poverty level. So there are clients that need to weigh their options. Do I pay my son something? Do I tell him that he's got to go out and get a little bit of a job? We'll supplement his income with some other monies that we will talk to our accountant about to get his income over that $11,000 threshold, have him file as his own person, not claim him on our taxes. This is mathematics. This is a serious conversation that you have to have with your clients, because in many cases it will behoove them to have that child on their own policy. But you need to identify this in your conversation. You need to go through it with them, make sure that they understand, and also weigh the fact whether that child or that adult child should be on their own policy. and if they will or will not qualify. So it's very important that you're taking those steps. Now, also, naturalized citizens, people who just have been to this country, we're having some questions about when we're in the marketplace and how is that going to be addressed. Well, the same rules of citizenship that we deal with now are the same rules of citizenship that the government is addressing and they are utilizing. So please make sure that if you've got someone and they're not legal in the country, they're not going to get a subsidy. They could have a tax identification number. They could be planning on staying here. That's fine. But if they don't have proper and legal documentation, they're not going to get a subsidy. Pretty straightforward. So in that situation, you're going to want to write a short term. Okay? Because as you know, our short-term policies do accept people who are semi-legal here in the country. And if you're not appointed with our HIIs, then please make sure that you get with Crystal. We can get you all set up with that as well. But those short-term medical policies are going to even be more important as we move through this healthcare reform thing. I've been standing on top of my desk, kicking and screaming, telling everybody, identify if you're going to qualify, identify what that subsidy is, balance the cost, and really take a look at it to see if you can get them in that healthcare reform plan or not. So, what other kinds of situations have people been coming up against before we get into some of the plans and how it's going to look in Blue Cross that you've been dealing with? I've got one here that's saying that I'm a little confused. If I'm only getting SSI early at 62, can we include income? Otherwise, they won't meet the 11.5. Well, is it SSI or is it just Social Security? Is it supplement Social Security? SSDI, or is it just standard Social Security? If it's standard Social Security and it's not disability, then if it's just standard Social Security, they can use it. If it's disability, they can't use it because regular Social Security is income and that will work. Okay, let me bring up another one. Here's one. How about a pregnant woman? If we have a pregnant woman, then what's going to happen is that's going to throw a glitch into the system, which they're working on. Pregnant woman, they're going to say that you need to apply for Medicaid. But that person may not qualify for Medicaid because they may be married. Believe it or not, these are some of the glitches that they're throwing out. So what could they do? Well, the pregnant woman could actually apply for insurance now, try and take care of her Medicaid. What the healthcare.gov site is telling us is that we need a letter from Medicaid showing that they don't qualify for Medicaid before we can give them a subsidy. This is probably going to change, but you need to be aware of what's going to happen here. And you need to be aware of what the experience is going to be. Okay. So no one else is having anything funky that's coming up when they're doing this. I've addressed the kids qualifying for Medicaid, talked a little bit about the Social Security and disability. Okay, here's a good one. What happens if the husband already filled out an app and did not include the wife and kids? Is there a way to go back into the system in the Blue Cross and add them? I'm not really quite sure if you're talking about the Blue Cross side of things or just doing the subsidy level. You need to do the whole thing over. If everybody's going to be on the plan together, then the subsidy application has to be redone for everyone. I don't understand why they won't do that. And Bridget, I'm going to unmute your phone. Maybe you can ask me that question so I can understand it a little bit better. Hold on one second. Let me just unmute your phone. Bridget, can you repeat or can you explain that to me a little bit? I'm sure other people have had that same question. Bridget, you're unmuted. Can you speak? Okay. Guess Bridget needs a Red Bull too. All right. So well, I'll get back to everybody on what her question is for the next one. But basically, if they are doing it, they need to, and they did it wrong the first time, even if they did it right the first time, you need to talk them into redoing it to make sure it's done appropriately. And the system is moving forward and working enough that if it's something basic, you typically won't have a problem. Next one, what about a working child? It asks for their income to contribute to the family. If it's a working child and the child is filing their own taxes, then that income is not going to be necessary in there. Next one, what about people who have annuities or other savings that don't work? Okay, well, savings is not income. Annuities, you're paying taxes on. So the annuities, rental properties, other types of areas that are income count towards this. Just like we deal with Medicare folks. So if you think about it from a Medicare standpoint, maybe this puts it in perspective a little bit. You know how everybody gets a penalty if they make over $85,000 as an individual or $170,000 as a joint filer? They get a penalty for their Part D as in David and their Part B as in boy. They pay a higher premium for those two pieces. Well, it's the same kind of thing. So if you've got a family and they're getting a high subsidy, but they cash in a bunch of stocks and bonds, or they have an annuity and that's showing up as taxable income, then they are going to be out of their subsidy for next year. And as you've all been through training, it's their responsibility to report that back to healthcare.gov. And in order for them to report that back to healthcare.gov, not for them to have or owe money at the end of the year. But also keep in mind, everyone, that the penalties that they have are flat fee penalties based on size of family. They're not going to have to pay back all of the money that they get, but they are going to have a penalty if they lie or if they are wrong. But you need to be conscious of that. Okay, so don't put someone in a bad position, because what's going to happen next year when they file their taxes? They're not going to say, oh, well, I just put the wrong amount on the healthcare.gov. They're going to say, oh, no. My agent, Jeff Schilling, told me that I needed to put my taxable income at this so I would get a subsidy, and I'd only have a small penalty, and that's all. And it was all his fault, so I'm not paying that penalty. So make sure that your errors and omission is up to date. Everybody has their E&O up to date. Make sure that you're doing the right thing, and make sure that you are following the rules. Next question. Kids will have an income at least 100% of the federal poverty level to qualify, correct? Yes. If you have a working adult child and that child's income is underneath the $11,000 number as a single tax filer, they won't qualify for a subsidy. So if I've got a kid in college and he's working at Applebee's 2 days a week and he's not making any money because he's a really bad server, or he's not claiming any kind of income and he's showing maybe $4,000 or $5,000 a year, you can forget it. He's not going to get a subsidy. If the parents want to supplement that income, let's just say he's making $8,000, $9,000, or $10,000, and they want to claim the $300 to $400 a month that they're paying him to live, and they want to W-2 him and talk to him with their accountant and show that as income, because they can do that. You can always pay more on your taxes. You can always say there was more money. The IRS will absolutely love that. At the same time, they've created this monster where they've done this. And if parents want to do that, they need to confirm with their tax advisor, talk to their CPA, see if that is something that they can do, get that taxable income over the 11,000 plus number, and then they will be good to go from there. But you can't advise anybody to do accounting advice. If you are an accountant, do not have a conversation about the insurance and the accounting in the same breath. When it's related to A and B, because if you're not a very good accountant, we don't want to be liable for your bad advice. So, moving on to some other questions. Would they be eligible on a group? If he is eligible to be on a group, can he get a subsidy? No. If you are eligible to be on a group policy and your spouse is eligible to be on that group policy, which is all the time, there are very, very few policies that are out there that I have not identified any that are only doing employee only. Some will do employee independence only, but not leaving out the spouse. If there is group coverage that is available, there is no subsidy that's available. Now, the family glitch means that the cost of the insurance for the employee only has to be under 9.5% of their income. So let's talk a little bit about that. Because I've had a lot of people say to me, well, it's really expensive for them. They really can't afford the coverage. How does that work? Well, just because they can't afford the coverage for the family, remember, this is the family glitch. This is one of the main issues that everybody is dealing with. If I have an income and I'm making $12 an hour, okay, my family insurance is $1,000 a month. But my insurance for me alone as the employee is free. Okay, I'm working at Taco Bell, not making very much money. My insurance is free for me, for example. Well, then it is affordable to me as the employee, and my family will not qualify for a subsidy, and neither will I. There are a lot of agents out there that don't understand this. We are not going to fall into that trap. You do not qualify for the subsidy if your income and the cost of your insurance is under that 9.5%. But remember, it's only the employee's income. So it's important that you understand that. Now, if there was a scenario, let's just say, take that same person, I'm working at Taco Bell, I'm making $12 an hour, but I only work part-time, but they still offer me the insurance. Well, then in that situation, if the cost of that insurance is more than 9.5% of my income, then in that scenario, I would qualify for a subsidy, and so would all of my family. Now, also be mindful that the family may not qualify for a subsidy, but it may be cost effective to have the family unsubsidized. It's highly unlikely that someone that's making a low income is going to be able to afford these programs, but this is another example of how you can write a policy, write a qualified health plan, or even an underwritten policy for that matter, because they are not going to get a subsidy, and it still may be less expensive. Big thing here is groups of two, small group businesses, businesses that only have a couple of people. Make sure that you're having this conversation. It may be beneficial to them to simply get a qualified health plan, especially for our individuals that are over 50. For individuals that are in their 20s or 30s, you can stick a fork in it and absolutely forget it. Not going to happen. But if they can qualify for an underwritten plan, then do so. Spoke with a attorney's office last week, and they have 4 people that are on there. They want to do a group insurance policy. They're all young attorneys. They're all going to do underwritten plans because it makes more sense. But fortunately enough, they're all healthy. But what would happen if that one person, the one administrative assistant that's been working there for 30 years, well, she's not healthy? Well, you could put her on a qualified health plan, even at the full cost, put everybody else on an underwritten plan, and save everybody a ton of money. Because you would even be saving that single individual a bunch of money as well, because if they are a little bit older, and even if they have those health issues, it's something to be aware of, but you have to be conscious of it. So you have to be addressing these unique situations. Clarify, a child making under $11,000 claimed on their parents does not have to count the income. If the child is making money, on their parents' policy and the parents are claiming them, if the child is filing their own taxes, that's fine. But if the parents are claiming them, then that child has to be on the parents' policy. The income is not being filed on the parent's income, so therefore that income level is not going to be listed on the healthcare.gov site. Okay, working on the site on Friday. I'm still getting booted off the site. I haven't been able to complete an application. You're just going to have to check all the things that we talked about in the beginning first before we go through that. We'll take that offline. Okay, someone's asking about how are they going to access the healthcare.gov site afterwards if we've created their account on the direct link? Great question. So, as you know, everyone is going to have an application identification number. Let me kind of see if I can pull that up on here, and then I'll show you what it looks like. And let's just go to probably about here. Let's see if I can find it. Give me 1 second. Okay, so it's a little hard to see, but if you see on the left-hand side of my screen, and I'm glad that you brought this up because it's something that I want to address for everyone that's having issues as well. So as you see on the top left-hand side here, you're going to see something that says application ID 151 blah 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 blah. That application identification number is a way that they would be able to look up and identify or make changes to their subsidy levels after they are enrolled. Now, that application identification number is the app ID that healthcare.gov is using to identify, in this situation, John Smith. So, make sure that they have that. They're going to get some letters and documentation in the mail when they enroll, where they would have instructions on changing things. Those changes can be done electronically through the website as well as through the mail. A lot of that is to be determined. There will be changes to that. But additionally, what's really important, and I want everybody to really listen closely right now, if you are having a problem on the healthcare.gov website and it's throwing you an error, or you feel that it's determining the wrong subsidy, okay, because you've done it a few times, or it's returning no subsidy, and you've clearly discussed this with me, and you've discussed it and understand that this person should have a subsidy, this is what I need you to do. I need you to write down this application ID number that you see on the screen right now. Not this one, the one that you have, along with the client's name, a brief description of the error, because we have written, I don't know, probably about 300 healthcare reform applications so far. And the easiest way for us to go back, and we're having really good communications now with HHS and Blue Cross, and we're able to talk to them about these errors, and they can go back and research them and fix them. It makes it a lot easier for us and for them to identify these problems that they've got internally, believe it or not, if we have that app ID number. So what you should be doing when you're doing these applications is you should have a pad or have a book, and you should be writing down the people's names and writing down this app ID number. You can go in and do it 2 or 3 times. You're going to get a different app ID number each time that you do it. And if you keep on getting that error after error and it doesn't look right and it doesn't smell right and you know that you've done everything correctly, write down that app ID number, shoot a quick little email to me so that way I can get it over to HHS. Okay? All right, couple other questions. Please clarify. CHIP shows 200% of the poverty level. You indicated the glitch starts below 250. Are we supposed to ask a client to estimate their income at 250 or just write the kid on their own plan? I don't know if I really understand that, but what I'm saying is that anyone who is under 250% of the federal poverty level that has kids on the application, don't be surprised if you get that error. And they probably don't qualify for CHIP, or they may not be in that CHIP or Medicaid status, and they want to put their child on Blue Cross. They're eligible to do so, but the system is not allowing it to go through. Okay. Next question. When a person says they're going to make $11,500 so they get a subsidy and they make less than that, will they get a penalty? Absolutely. They're totally going to get a penalty. If they don't make over 100% of the federal poverty level, they will get a penalty. Okay, that's why they're supposed to be able to go back in there and adjust that if they're not getting the appropriate subsidy. Next. Oh, hold on. We don't want to listen to that. Next is going to be a question that a client is living off of the sale of a home until they get a job, but they don't want Medicaid. Well, they don't have income. Is everybody starting to see the pattern here? Everybody's asking the same question, which is fine because this is a training session, but it's got to be income. If you're living off the sale of a home, if you're living off inheritance, guess what? You don't have any income because you're not paying taxes on that. If a spouse dies, that's not income. That's a life insurance policy that you're living off of. It doesn't count. Okay? It has to be income. And in those scenarios, they don't have any. Okay, married couple, husband is on veterans coverage, wife has no coverage. How do I write up her subsidy? Okay, does she have income? If she doesn't have income, then she doesn't get a subsidy. If he's on VA coverage, you just simply put that he's not taking the coverage. He has other coverage. Again, you're probably going to run into a glitch with that one, Jose, because it depends on who is the main tax filer, because that's going to be a problem. Remember, the people don't have to take the insurance. Okay, here's a good question. What about if somebody is eligible for COBRA? Great question. COBRA is not a group insurance policy. They would be eligible for a subsidy. They'd be eligible to get on the policy. You just wouldn't put that eligibility in there because they have that coverage, but they're going through a subsidy. They would cancel their COBRA and go on this policy. Okay, what will the effective dates be in underwritten plans in December? Not a problem. The underwritten plans are going to have an effective date of December 15th. So if you write it on December 23rd or December 30th, depending on what they finalize that cutoff at, they'll backdate it to the 15th. And there'll be some more communications coming out this week about that. So we'll let you know as those come through. Remember, there's a lot of changes that are going on, and there's a lot of things that are, kind of going about it. All right, back to Jose's question. She's the main earner, so therefore, with that veterans coverage, you have to put him on the application, not getting any other coverage. So, right. And where is the tax? Is there a tax situation cheat sheet that we can reference? No, because the tax situation cheat sheet has been covered in all of the verbal trainings. I haven't put one together, so we don't have one of those enough. All right, so Dan is asking me if I don't love him, why am I not answering his question? But I don't see the question that he's asking. So, Dan, re-ask your question because I do love you quite a bit. I want to snuggle you and give you kisses, but I don't know what your question is because I didn't see it. Okay, so as we get some more questions coming through, let's kind of address some of the situations that you're dealing with once we get that subsidy determination. When you get the subsidy determination, at the bottom of the screen, there is a green button that says Return to the Insurer website. You would then return to the Insurer website at that point. When you return to the... Oh, hold on. I don't want Dan to think I don't love him. What about early withdrawals from IRS? Is that income? Early withdrawals from, you mean an IRA? An IRA. If the IRA is taxable income, then the IRA is going to show up as income. It's income. Income is income. The only income that's not income is disability income. Makes it pretty straightforward. So I do love you, Dan. I'll give you a hug next time I see you. And let's go on to, another question. Can you add a parent to your policy if he or she is working independent? If we're talking about an adult parent, no, you cannot. As of today, you cannot. So adult parents are not going to count on there. All right. Perfect. Me and Dan are having chat cuddles at this point. All right, so moving on. So now we're back into Blue Cross. So we click that little green button at the bottom of the screen. It returns us to the insurer website. The first thing that you're going to see is you are going to see how much of that subsidy that you want to apply. A little slide bar that's represented in this eligibility determination right here. You get your little slide bar in this video. Go ahead and reference it. So right after you get that determination, as you see right here, it's going to spit out a PDF for you. You get that PDF, and then after the PDF, the little button that I'm talking about is going to be right there. Okay, so go to the insurer website. That's going to bring you back to Blue Cross. Now, when you come back to Blue Cross, it's going to look a little different, but the first thing that you're going to do is apply the subsidy. Okay? This was really clear on the video. So when you apply that subsidy amount, what's going to happen, first step, it's going to ask you who's the primary applicant. This is where the errors are going to come up. So you need to first identify the primary applicant. Make sure that you have that determination of that subsidy on that PDF. If that PDF does not have the determination of the subsidy, you're going to redo it. Or maybe they don't qualify for a subsidy. It's going to bring you back in, and then it's going to give you the list of the plans. Okay? So now when you're looking at the list of the plans, this is when you need to have all of your brain power working on full capacity, because this is not an auto quote. Now, we sent out a cheat sheet. Everybody should have a cheat sheet. There is the cheat sheet in Blue Cross that you can utilize that has all of the benefits that you're going to want to look at. I want to give everybody a couple of really good pieces of advice. First and foremost, do not use bronze, silver, gold, and platinum buttons that you see here up on the top where it says filter by metal level. Because the metal level, who cares what metal level it is, right? I mean, really, it doesn't matter. What you have to understand is the networks. So the first thing that you want to identify is how that person is going to use the policy, their doctor participation, and the networks that they can play in. For example, you don't really want to sell a Blue Select because of the hospital choices. But if you can talk to your client and you can identify that their doctors take Blue Select and that their hospitals that they want to see are going to be within the Blue Select network, then that may be a good, viable option. Blue Care, our second largest network, and it is an HMO. But please don't call it an HMO because you don't need referrals. And we have to change our mindset on Blue Care about having an HMO and having referrals, because you don't need them. What you need to understand on the Blue Care is that if you leave the state of Florida, you have urgently needed care and emergency care, and that's it. You can't go to a doctor. You can't get elective care outside of the state of Florida. And you have to stay within the network of Blue Care in Florida. Really straightforward, pretty easy to understand. And there are no referrals that are necessary. And Blue Options is our standard Blue Options policy. Now, the reason why I say you really don't want to use gold, silver, gold or platinum. Stay away from the redheads too. Sorry for all the redheads on this call. Because realistically, you want to understand what your client wants, and you need to have your book of plans in front of you or your cheat sheet in front of you so you can understand what the benefits and what the benefit levels are going to be. In addition to that, you also want to be conscious that your A, B, and C's that you will see following these long numbers will only be represented when you're using subsidy calculations. Because once you have identified a subsidy amount, then what will happen is if they are under the threshold of 250% of the federal poverty level, then they will also be getting an increased benefit package. They will also have a lower out-of-pocket. They will have lower deductibles. And the only time that that's determined is when their subsidy is applied. So in the situation where you don't see a C or a B or an A, well, guess what? That means that they're over 250% of the poverty level, and that's not the benefit package that they're going to get. So when we did training, we talked a lot about essentials, and we use these names, which we don't normally use names. We use numbers. Well, the numbers are kind of confusing. But what you're going to want to do is you're going to want to have the crosswalk. Now, that crosswalk document is in Dropbox. I'll resend it out to everybody today. I will also resend out to everybody on the call today the plan cheat sheet so you have that. But you need to understand all copay, essential, HSAs, predictable cost plans, and you have to understand these basics. Because how those plans function and how those plans are going to work are going to be different. But you are able to take someone from a blue, you could be looking at a blue options bronze, and you can move all the way up to an all copay plan or a low deductible predictable cost plan just by altering the network. So a little different take on how we're going to do things when we're looking at the plans now. We don't have an auto quote. So don't be prepared to have an auto quote for a little bit of time. That's not going to happen because of all the variables. And that's why the cheat sheet is designed with the drop-down boxes that you can send them to people. You can copy and paste them into an email. But again, there's urgency. There's time is of an essence. And you don't want to be sending out quotes to people that are for these subsidies. Once you identify the subsidy, you want to move right through the process, make a selection, build the urgency, and get it done. The subsidy will be automatically applied as you get to that first screen that is clearly done in here. And if you go to this video, you'll see the little slide bar, and you'll want to make sure. So here's that slide bar that I was talking about when you want to apply the subsidy. So as some of these questions are rolling in, this is when I could really know who watched the video or not. So you will just address that slide bar, make sure that you apply the amount of subsidy. If your client doesn't want to use all the subsidy, well, they don't have to. I'll be shocked if anybody doesn't want to. But otherwise, you would put it all the way to the right-hand side. And then when you go in here and you're looking at the plans and you're doing a plan comparison, then what will happen is it will have that subsidy applied automatically to the plans. Now also, when you're in this compare plans, these compare plans are something that you want to utilize like we would normally utilize your auto quote feature. Now, when you're using this policy option here to review the plans, you will first see your mini benefit summary. You will also see the full summary of benefits and coverage, all of which should be done on a Join Me, because you're not doing any of this process unless you're on a Join Me with your client. Go through this, look at the benefits, make your selection, and then just as you would have before, go down. You will also see vision benefits as well as dental benefits and the medication guide for the medications that are listed. It's also the place that you're going to see the out-of-network benefits, because there are no out-of-network benefits listed in any of the cheat sheets that have been done or any of the information that Blue Cross has even given us. And I will keep you up to date, because as these things change and as Blue Cross updates certain areas, you're going to need to be updated as well. So I've had a lot of questions about the plans. The plan details we're going to cover on our next call today, because I want to get things cut off in the next 8 minutes. But as we're looking at these plans, a couple of the big things you really must need to know. First is going to be the Value RX portion of the policy, which is going to be for preventative medicine, $4 generics, free through mail order, and 50% off of medications that are for maintenance that are brand names. All within the policies, and those are within all of our policies. The preventative medicine medications are not subject to the deductible. Remember, we want to get people healthy, and the healthier that we can get sick people is the more money that the government is going to end up paying Blue Cross in order to get us better benefits for next year. Also, you have to understand that everything that the client pays out of pocket goes towards their total out-of-pocket maximum. Now, be conscious of the out-of-pocket maximum and the deductible, because everybody's very comfortable with saying all of your copays count towards your deductible because we sell a lot of 533s. But for healthcare reform plans, you have to be careful, because your copays count towards your max out-of-pocket, not to your deductible. In a situation where your max out-of-pocket is your deductible, then it's the same. But that's not how any of the plans work in healthcare reform except for HSAs. So, for example, if you're looking at the Platinum plan that's in front of you here, and you see it's got a 0 annual deductible. Okay, but with that zero annual deductible, it has an annual maximum out of pocket of $2,000. So how do we get to that number? That's because all of your copays count towards the out of pocket maximum. All of your drugs count towards your out of pocket maximum. And when you satisfy that out of pocket maximum, you are covered for 100% for all medical services for everything, including drugs. So be conscious of that when you're picking a plan with someone who's very unhealthy. It may make a lot more sense for them to pick a platinum plan or a lower deductible plan because they take a lot of medications, because those medications are going to count towards that max out of pocket. And they could satisfy their maximum out of pocket just with medications that they're going to take anyway. Also, another thing I want to address is the first 3 visits. The first 3 visits are for regular doctors, not for specialists. So, you would go to your regular doctor 3 times per family member. So, if you have a family of 4, that's 12 primary care doctor visits for free, and then a copay after that. A specialist, a $75 copay. Those, again, we are going to have no balance billing on any of our plans. You are not going to have any of those extra bills rolling in. You may experience a balance bill on a Blue Care policy. It's highly unlikely, but you may, because balance billing protection is not built into the Blue Care network, but it is built into all of our other policies. In addition to that, we have our copays for the emergency room on many plans. And you'll see a $75 copay for the emergency room as listed here, and then it goes up. So understand that. Good question, Kerry. Wellness visits do not count towards those 3 visits. You are absolutely correct. So you're actually getting 4. And for ladies, you'll be getting 5, because as we know, for ladies, we get a female adult wellness. We get an adult wellness, so you girls get 2. Thank you. And then you would have 3 sick visits. So you get an earache, you go. You have a headache, you go. You have a stomach ache, you go, and you don't pay any copays for the first 3 visits, and then $55 after that. Most people don't go to the doctor more than that anyway. But if they do, you have good solutions for that. So, be conscious of those, be conscious of the benefits, and really make sure that you understand how these are going to work. Couple of questions that are rolling through are the same HSA plans. Are the HSA plans using family or individual under reform? I'm not quite sure if I understand that question, but you have the way that the deductibles work on the HSAs are a little bit different. You would have an individual that would satisfy the deductible, then you have an individual deductible. We're going to cover that when we go into the family details and plan details on our next call. But know that if you have that bucket of money that's getting satisfied, then everyone is going to be covered at 100%, just as if we were doing it in today's marketplace. So do the meds count towards the total out of pocket? Yes, they do. Okay, is a dermatologist part of a wellness visit or a specialist copay? That would be a specialist copay. Wellness visit is under dermatology is not counting. Why is Blue Select not a good choice? Okay, well, Blue Select is a good choice if their doctor takes it, if the hospital takes it. However, there are a lot of doctors and hospitals that don't take it. It is the smallest of our networks, and those people who buy Blue Cross typically like the flexibility of the network, being able to move in and out of network, being able to travel, being able to have in-network doctors anywhere they go, and never having an issue. I'll give you a perfect example, Pauline. Walgreens is out of network on Blue Select, but they are in network on Blue Care and Blue Options. So you just must be conscious and manage the expectations of your clients of those networks. And if you have any questions about the networks, believe it or not, there's a handy-dandy video on our YouTube page that will show you how to identify those networks, how to find those networks, and please make sure that you watch that as well. The networks really lend to a huge opportunity for us because the other carriers have the smallest networks that are out there. We're not even dealing with United Healthcare this year because they're not even playing in the marketplace. Aetna's got a very small network that they're using. Coventry is using a small network. We also have Humana using only their HMO networks. So the opportunity for Blue Cross in this enrollment period is to really focus on our networks, focus on the flexibility, focus on the choices that we're giving to our clients that far surpass the other carriers. The other carriers, some don't even have a platinum plan. So you really have to really play up the Blue Cross and really understand why Blue Cross is so important for everyone because remember, we're the only provider in over half of the state. 35 of our 67 counties. We're the only company that somebody can buy one of our plans in, get a subsidy. Okay, great. So my next and last thing I want to talk about is this damn dental that's on these plans. There seems to be a lot of confusion with the P's and the non-P's and pediatric dental and zero-cost dental. So here it goes. If you have children on the policy and it's a family policy, you have to pick a P. There is no other way to process it unless they have another qualified dental plan through a group or another carrier. So everyone is going to pick a P if there is a child under the age of 19 on the policy. If there is not a child, for example, this quote it would be for a 37-year-old, 38-year-old person, and there is no P after this policy. So what I would have to do is I would have to now go back and select a qualified dental plan. And with that qualified dental plan, if I didn't want to pay anything more, I would have to select one of the zero-cost dental plans. And you can see now that what they're doing is they're removing those P's, the zero-cost plans, so you're not going to have to add it. They're starting to make it internal now. They're starting to fix everything. But if you see your qualified dental plans and you see all of the plans, you have to add the zero cost if it's available, and you're not adding a P. So, shockingly enough, at a zero cost plan, there are no benefits. They will probably have that fixed completely for everybody by the end of the week. But for example, if I wanted to add dental, I would update my proposal, and then I would update that proposal, and I would have to add both the qualified dental plan as well as the standard plan without a P. But if I'm adding the P, it is not necessary for me to add the qualified dental plan. Additionally, you want to make sure that you're also talking about ancillary benefits. Don't forget, we still sell accident plans, critical illness, and these other plans that you are also going to want to utilize. So, for example, if someone's highly subsidized and they want a very low-cost plan, but they're taking an HSA that has a higher deductible, you can still add your VBA or your accident medical expense protection to that. All right. Would a customer receive a provider directory after enrollment? No. Provider directory is only available online. That is a CMS thing. We don't send them to people in under 65. I'm not going to be repeating anything about Dropbox today. We've already put an hour into this. What I'd like to ask, if anybody has any other questions about the things that we've covered, the process, using this system, and doing the application. Details about the plans, they're covered already in YouTube. We will cover them again. I will be going through a series of webinars and recorded webinars specifically for each style and series of plans, as well as the network. So does anyone have any questions? Because if we don't, I want to let everybody carry on for the day. I know that everybody's got a lot of cleanup work to do from Medicare season and things like that. Any questions? Any comments? Is everybody sleeping? Okay, great. All right, so I will expect a bunch of questions on this when everybody is knee deep in it and doing it. Make sure that you're please referring back to the YouTube channel for all of the basics. Please try and address these basics before you pick up the phone and call. It is really all about making sure that you know understand these basics. Now we can start getting a little bit more progressive and start to go into some more in-depth training. Today was really geared for everybody just to make sure that you had all of the basics covered, you were comfortable, and I really look forward to a huge selling season for the Affordable Care Act. So we are going to do really good. I want to also thank everybody for a great Medicare season this year. Please make sure that all of your apps are turned in by tomorrow. There's no reason that you shouldn't spend today getting it all cleaned up. We should have no loose ends tied up on that. I want to thank everybody for their time today, and I look forward to talking to everybody on our next training. So thank you, everybody, and have a great day.